My tenure was challenging and exciting. Um, Challenging for the fact that when I was appointed, that was in the middle of hepatitis A outbreak. And when we were still busy with the hepatitis outbreak to control it, a year later, then we were in COVID-19. So for the 2021, 2020, 2021, and part of 2022, we are struggling with COVID-19. Basically, my tenure as a minister to do the actual work of a minister, it was only starting from 2023. That is when COVID-19 have ceased, and then we have now started to concentrate on the ministerial program according to the ministerial mandate.
Okay, Doctor, you mentioned that the work actually started 2023. What happened to the previous years before that?
No, before that, as I said, we were fighting COVID-19. And you may remember that in 2021, we had the West variant, COVID-19 variant, the Delta variant, which actually claimed a lot of Namibian life.
So, what would you say was your biggest accomplishment throughout the years, your tenure?
Well, I would say that the first one that we overcome hepatitis A. That's a big achievement. We overcame and controlled successfully COVID-19. That we consider as a very big achievement. But also, we were able now to focus on certain programs, like the introduction of the dialysis program. It was the first time in Namibian history that we have instituted such a program. And then also after COVID-19, we realized that we had a shortage of ICU beds. And now we have expanded the ICU beds in hospitals where they were, that's Soshakati, Windhoek Central Hospital and Katutura, to all 34 district hospitals. All district hospitals currently now will have ICU units. That's also a very, very big achievement.
Okay, that's great. Coming back to the dialysis, okay, effective.
Well, the dialysis unit is actually it's an intervention where people with kidney failure and without dialysis they will die. So basically, those machines they are helping to do the work of a kidney in an individual. And we have those in Katutra Hospital. They have already been commissioned. We have those in Oshakati Hospital. They have been commissioned and they are working. And we are ensuring that the remaining hospital, Keetmanshoop, Katima Muliro Hospital, Rund Hospital, Njokwe Hospital, Wolfers Bay hospitals, they are currently under construction and they will be put to use very soon.
Doctor, from here, where to? What are your plans?
Well, I'm a medical doctor by profession.
Are you still going to continue your work within your
I will
profession?
not be far from the medical fraternity. Then I also want to document, to write. So that has always been one of my passion, and that is one thing I'm going to consider when I will have sufficient time, I hope.
Mm. So is it something that you have done already, or is it something you're willing to embark on?
I have been I have written scientific, medical science articles in the one in the book, and then I have written a book, so I have been encouraged to continue writing. You know, our first case was detected on the 13th of March. By the 17th of March, the country has already declared a state of emergency. So that is how fast we have responded. I can tell you one story. One day after COVID had receded, I traveled from here to Johannesburg. Now, at the airport, there was a couple who were looking at me. And then when we reached in Johannesburg, the lady came to me. She said, I just want to say thank you for what you did during COVID-19. She said, we are from Australia and our country made a mess of COVID-19. And we were happy that we spent the period of COVID-19 in Namibia and not in Australia. So that is somebody from outside objectively analyzing our response to COVID-19.
Upon getting those remarks from this couple, how did that make you feel?
Well, I felt, humbled, really. And that is something which somebody whom I don't know, who only know me through the television, and saying that, giving that compliment, and it's not only from that individual. Organizations, WHO, and other international organizations, they were really looking at how Namibia has managed the pandemic and how other countries has done. You see countries with enough resources and enough money, like the United States of America, they struggled. They lost more than 1 million people who have died. Well, we are talking about 3,000 people who have died. They are talking about 1 million. Of course, they have a bigger population, but of course, it depends. But they have all the resources. They have the vaccines, they have the people, they have the medicine, they have everything. But still, they could not control. That is the complexity of COVID-19.
All right, Doctor. The COVID-19 relief funds and procurement process were marred by allegations of mismanagement. How do you respond to claims that funds were not handled transparently?
Well, I'm not aware of those allegations. Now, people must understand that we're in a situation of emergency. And in a situation of emergency, you do not go through the normal procurement method. But according to the Act, we are allowed to do direct procurement. And that is what has been followed. So far, nobody has come with evidence to say that it is actually this and this that there was irregularities. Nobody, and you can ask anybody. Nobody will give such evidence. But of course, people will always talk.
So it has been reported that some healthcare workers felt overworked and underpaid or underappreciated during the pandemic. Do you think the ministry did enough to support them?
Yes, definitely. I don't know who came up with those allegations, because the staff themselves, I can tell you, they have worked day and night to save lives. Some of them were infected. Some of them actually died. But the moment they get well, they come back to continue with their work. They have been appreciated, and I can tell you, during COVID-19, when we have the 26th of August is a Heroes Day. 2020, the president dedicated the Heroes Day to the healthcare workers. 2021, the president, two consecutive years. When it's the Heroes Day, the president dedicated that to the healthcare worker, to the responders. And I think somebody who said that they are underappreciated is not correct. Yes, indeed, there was an issue of a request for additional payment, but that could not be granted because of various considerations. But it does not mean that they have not been appreciated. Even patients, I have an article from one of the patients who survived COVID-19 in Katotora Hospital and is giving a very emotional talk, saying that when I used to hear about Katotora Hospital, I was dreaded to find myself in that hospital. But for the 10 days I have been in that hospital, I never thought I was in a government hospital. And they saved my life. And I know that she said she knows of some people who were waiting in a list to be admitted into a private hospital, and some died in the car or on their way to go there. But she said, my stay in Katotora Hospital really gave me a different perspective of government hospitals.
Speaking about the article, Doctor, I've also seen it because it was public. This actually media practitioner who wrote that article.
I see.
Yeah,
Okay, I
I've seen
see.
the article.
Okay.
Yes,
Yeah.
watch
Yeah.
to our hospital.
Yeah.
Was actually trying to avoid the misperception
Yeah.
people know about.
Mhm.
So, apart from the challenges that you have mentioned, what would you say that was the most difficult day of Kenya? What day would you perhaps recall that was the most difficult?
Yeah. I recall one day during COVID-19 where I really felt bad. That is when I had to inform the public that in one day we have lost 150 people due to COVID-19. That was the worst day for me when I had to announce that. 150 people. It was just too much.
How does this take a toll on your mental health?
Well, I must say that probably my background have prepared me for that. I have undergone very rigid, strict military training. And you are taught that if you are a commander, how you need to behave, because the soldier, they are looking upon you. If you are afraid, they will run away. But if they show courage, then they will follow you. So there were those principles which guided me throughout the pandemic, that never allow a situation to be on top of you. Always be on top of the situation. That has been my guiding principles, and it helped me go through.
So many hospitals, public hospitals and clinics, are in poor state with reports of dilapidated buildings, lack of basic equipment, and even shortage of essential medicines. Why has the ministry struggled to address the?
Well, I think to say that the hospitals in dilapidated situation is on over exaggeration. When you get into our health facility, it's just like when you are coming to this building, you will not say it's dilapidated, but there are individuals who are fixed with the word dilapidated. Of course, some of the health infrastructure were built sometimes ago, and there is always wear and tear. But you need to appreciate the fact that the country is big, and when you have one referral hospital, 4 intermediate hospital, 34 district hospital, 44 health center, 282 clinics all over the country. Obviously, with the small economy of Namibia, you will not be in a position to renovate them all at the same time. You will not have that fund. So the economy of the country dictates how we address pressing issues. But I can tell you that we have done a lot. Katutra Hospital has now been renovated. They have the best emergency unit, which has been renovated. All the floors of Katutra Hospital have been renovated. The same happens with the Windhoek District Hospital, Windhoek Central Hospital. We also have expanded and built during COVID-19. We had special, wards for COVID-19. They were not together with the, and this happens with the places like Oshakati Hospital. We are now building there a very brand new ICU. I just returned from there. I have been in Katimamuliro. We have constructed a new ICU, dental unit, a dialysis unit. So, and many clinics, we have completed them, those who were abandoned. But I must say that the tempo at which we move depends on the available resources. It's also sometimes that our procurement process, takes so long that we are unable to keep up with the pace of renovation. But we have constructed, we have built up a very extensive program, and we have costed that program for the renovation, employment, medical equipment, etc., up to 16 billion Namibian dollar. It was approved in 2023 by cabinet. So the point I want to make is that yes, structure age, not only hospitals, but everywhere, even in our houses. Even in our houses, you need always to continue to renovate. But it depends on the available funds. If you have got funds, you can do everything in one day. But of course, Namibia has not that luxury.
All right, doctor. Moving forward, patients continue to complain about long waiting times and inadequate staffing in hospitals. What efforts were made to improve service delivery, and why do these issues persist?
Yeah, they do not persist. It is true that we are experiencing long queues. Most of the facilities, when they were constructed, the Namibian population was 1.4 million. Now we are talking about more than 3 million Namibian people, which means the population is growing. So obviously, when the population is growing, it means there are more people who need health services. And if the infrastructure does not keep up with the growing population, then of course one will experience such things like long queues. We have tried to address that one. For example, we are currently building, in Windhoek, we are building a new district hospital, the Windhoek District Hospital, is to relieve pressure from Katutra Hospital and also from other clinics around Komas.
When is that expected, doctor?
The construction is starting, but of course, the groundbreaking was already done. Now, we have, at the present moment, is the procurement for people to do bulk services, that water, to put in water, electricity, and also the road to get there. And then once that phase is finished, then it will be the actual hospital building. According to the normal construction period, it is supposed to be complete in 2029. But we have, together with the architects and the consultants, shortened the period to 2027, because we said that some of the processes must run parallel, because there is really a great need for that hospital. It's going to be a 500-bed hospital. So that is one thing we have done. We have also, since December, we have been advertising and recruiting health professionals. For example, we have improved, we have recruited 40 doctors for Shakati Hospital alone. We have recruited 40 doctors for Katutura Hospital. We have recruited nurses, we have recruited pharmacists, we have recruited all different kinds of health professionals, just in order to improve service delivery.
And these healthcare providers, were they recruited from Namibia or also outside Namibia?
No, most of them, they are from Namibia. Yeah, because we have now a very rigorous program for the interns, medical interns. Wherever they are trained, they will come here, they do 2 years internship training, and then we recruit them to go to the hospital. It's not only those two hospitals, but all other hospitals. They have received doctors, they have received nurses, and they have received pharmacists. So this way, we expect that the workload on the existing staff will decrease, and the quality of services will improve, and the waiting list, the long wait for services will decrease.
Rural healthcare remains a challenge, with some areas having no proper health facilities. What strategies were put in place to improve healthcare access in remote areas?
77. Okay, one other thing unique for Namibia is that Namibia is a big country. It has got 824,000 square kilometers. Now, it's one of the country in the world with the lowest population density. Three persons per square kilometer. That's very, very small. So the challenge with that is that you can travel for 100 kilometers to provide service to 50 people only. But we have done quite a lot with the distribution of health facilities, clinics, and we still continue to build them in the rural areas. So according to the World Health Organization, 70% of the Namibian population, they are within 10-kilometer radius to a health facility. That's a very, very big achievement for Namibia.
Right. The health ministry has received funding over the years, yet issues persist. Do you think the budget has been used effectively?
The budget has been used quite effectively. You know, when you look at the budget for the Ministry of Health and Social Services, you look at about 10 billion Namibian dollars. Now, you have the number of hospitals and clinics which I have talked to. The current staff establishment is more than 20,000 people. That's people who receive salary on a monthly basis. The money which you get, you have to pay the salaries. You have to make sure that the patients are eating. You have to make sure that they have medicines. You have to make sure that they have vaccines. You have to make sure that they have diagnostic equipment, X-rays, sonars, CT scans, cobalt unit. For example, on Monday, I commissioned the one equipment, cobalt 60, at the Venus Central Hospital for treatment of cancer. And that one is costing 16 million Namibia dollar. Just that one, 16 million Namibia dollar. So our equipment, they are very, very expensive. When you look at the theater, you look at the type of lamps to help the surgeon to see when they are operating. You look at the anesthetic machine. You look at the bed where the patient is lying, and many other things. You are talking about more than a million already for one theater only. So although the budget looks big, the demand for the money exceeds that, because you don't only have one hospital, you have many hospitals. In all those 34 district hospitals, you ensure that they've got X-rays, they've got ICU, they have got they've got anesthetic machines, they've got doctors, they've got specialists whose salary is not small in terms of the budget what you have. So the money has been used efficiently, and you also have patients where we do not have those facilities, and we have to refer them to the private sector, and that costs a lot of money.
So, how about the allegations of healthcare workers using cell phones during operations? Okay. Are you aware of that?
Well, I'm aware of that one, and it's not a new thing. The cell phone has been here for a long time, and before that it was the landline. That complaint has always been there ever since there are hospitals. Patients, they say, apparently health workers are busy on their cell phone while the patients are working. But already in 2016, we have issued a directives that nobody, no staff member, should be using the cell phone while patients are waiting. That has been in existence for almost 9 years now.
Apart from the one doctor mentioned of using cell phones during working hours, I was referring to the lamps, them using the cell phone as a lamp during surgery. Are you also aware about that, doctor?
No, some of the things are being exaggerated. You see, I can talk about my own experience, and I don't make a fuss about that. I was in Oshakati Hospital, so I got a patient who needed urgent operation. I took the patient to the theater. The patient had internal bleeding. I opened up the abdominal cavity. I saw the lot of blood. I saw the source of the bleeding. I clamped the source of the bleeding, and the lights went off. The lights just went off that particular moment.
Electricity?
Electricity just went off. So what we did, we took the what is it? Not cell phone. The torch. I completed that operation with a torch. Now I don't go around saying that I completed the operation with a torch and make noise about it. These things can happen. It can happen to anybody. We do have, all of a sudden lights goes off, and if the lights go off, you use whatever is available to accomplish your task, and it doesn't mean that you are the cause of the power failure. The power failure can happen like now. It's raining, you may just hear that there is no light. So some of the people, when they talk about things, it's simply maybe expose them that they are quite naive. You have to look at things in perspective. And when you are encountering an emergency, you have to be able to see how you get out of that emergency.
All right, doctor. There have been allegations again of corruption and mismanagement within the ministry regarding tenders for medical supplies and construction projects. What has been done to ensure accountability?
Again, this is misconception. Let me talk about the tender for medicine. You know, there is what we call Public Procurement Act. The Public Procurement Act established the Central Procurement Board. Now, as a ministry, when we need to buy medicine, we have three types: the RV tender, the tender for pharmaceutical, and the tender for clinical supplies. What we do as a ministry, we do the specification. They say this is what we need in our hospitals. They are sent to public procurement unit in the Ministry of Finance. And from there, they go to the Central Procurement Board. The Central Procurement Board, what they do, they advertise, they receive the offers, they adjudicate, they award that this is going to be the company. Now, because the ministry is the consumer of those products, people think that we are the one who are doing the procurement. We are not doing the procurement. And if the person does not get the tender from the Central Procurement Board, not from the ministry, then they allege that there is corruption. Now, just if you analyze that process, just tell me where the corruption within the ministry comes in. Is this when we say this is what we want? It does not make any sense. We only buy emergency, and our threshold is 25 million only. And with that one, you are not in a position to buy something which will be covering the whole country. The same apply to project, except those who are below 25 million. And what is happening is that quotation will be sourced, and then depending on the offer, then you take the one which is more responsive. Now, with the pharmaceutical, I can tell you that since 2021, August, we submit to the Central Procurement Board for pharmaceuticals. Now, when they adjudicate and award, among the suppliers, they start fighting among themselves. Then it goes to the review panel. The review panel make a determination. It comes back to the Central Procurement Board. Again, it's challenged. Then they go to the High Court. Then they go to the High Court. The High Court make a determination, comes back. They appeal to the Supreme Court. As we are talking now, why we still experience problem within the hospitals with the medicine? As I said, since 2021, that tender for medicine is now in the Supreme Court. And apparently the Supreme Court will only hear it in April. So the allegation of corruption in procurement of medicine is misplaced, because that process does not happen in the ministry.
These other questions are similar. I think doctor has already answered most of this.
Mm-hmm.
Yeah, if I have to ask about the contribution that you to the healthcare delivery, you have mentioned that at the start with the hepatitis E, you can that. So I don't think we have to repeat on that again. So I think now we have come to the lighter part of the interview. Just who is Kalumbi Shangula?
Well, I'm the third born in a family of 10, in a family of 10 siblings. We have four. We were 6 boys and 4 girls. Now, some of them have already passed on. I grew up in a small village called Etilyasa. I was looking after my father's cattle.
Lessa.
Etilyasa
Omusati region?
in the Msati region. I grew up looking after my parents' cattle, tilling on the land, attending a primary school locally. I went over up to um, secondary school, and then from secondary school, I went up to university. Um, I qualified as a medical doctor. Initially, before I came back to Namibia after exile, I was working at the front, military front, when we were fighting for independence.
Was it the military side or military as in the army?
Well, initially, before I qualified as medicine, I was a fighter, and then I went back to school. I qualified as a medical doctor. I was the chief of the medical services for the People's Liberation Army of Namibia. Yeah, so that is the role I have been playing, looking after the health of our soldiers, of our plant combatants, and also the surrounding community until I came back.
Have you always wanted to be a doctor, or was there another profession like in mind? How did it come about? You just there looking after our dead cattle and decided that I would like to be a doctor one day.
Well, to be honest, when I was at high school, I never, uh, I never said, I never considered what I wanted to. I only knew what I didn't want to be.
Mm.
Yeah.
Which is
One, I never wanted to be a teacher because I have seen the way we were treating the teachers as learners, how we mock them, how we play, make fun of them. Then I say, if I'm doing this to the teacher, I don't want this one to be done to me. So that's one thing really which scared me to become a teacher. Although I respect the profession, but also the other thing is that when the teacher tried to explain and the people are not understanding or they are not even listening, they are putting in effort, but the cooperation is not there. So it put me off because we were doing it to the teachers. And then I said, no, I will not become a teacher. But then I was very good at science at high school. It was really my mathematics teacher who said that, why don't you consider to become a doctor? And then that time, there was nobody I could relate to.
like
A
looking
black,
up to someone, like
yeah,
a role model.
a black doctor. There was nobody I could relate to. So it has never come to my mind. But my mathematics teacher encouraged me. And then this is how the idea of me becoming. But then later on, I start appreciating it because as a doctor, you are helping from a child being born until the person dies. It will be in the hands of a doctor. So that is also what brought me satisfaction that I will be in a position to help everybody.
So what did you specialize in, doctor?
Well, I did my Doctors of Medicine in Moscow. I did a postgraduate at the University of London in tropical medicine and hygiene. And of course, after that, I also thought that I have to do the MBA because running an institution requires that you have that expertise.
you so much for your time, Doctor. Is there anything else that you would like to add, perhaps, before we conclude?
Yeah, I just want to say that, the healthcare system in Namibia is really meeting international standard. And that's why here in Namibia, we really do not have any need to send somebody outside Namibia for treatment. Namibia has advanced to such an extent that it can treat almost 99% of conditions in the country. And therefore, the public is urged to have faith in the system we are putting in place and cooperate. Because without cooperation, then our effort will not bear the desired fruit. So let us have faith in the system we have. We can still perfect it, but it's working. And I just wanted to emphasize that point.
You would say like it's a milestone.
It's a milestone. And many countries actually in the world, they admire Namibia for that.
The portrait. Is it your son, Doctor, or is it you?
No, that's myself. That photo was taken by one of my teachers.
Can you just look at it?
Yeah. As you see, I am having a pen. This I was doing from 2. That's now grade 9, I think. Yeah, it's grade 9. I was under the tree in Badiva High School preparing for the examination. So you take a chair, you sit in the shade, and then you study for the examination. Now, one of my teacher is a Finnish teacher. He was just passing while I was studying, and then he took a photo. I was not aware of the existence of this photo, and then apparently it was published in a book, in a Finnish book. Somebody got hold of the book and then took this picture. So one day while I was here, I was told there is somebody who wants to see me. It's a young boy who is in India. Then when he came, he said, I got hold of your photo and then I framed it and I'm giving you as a present. So this is a present from somebody who I didn't know before.
I'd like to question because of the era of the 60s. I'll just retake that one, and I think we can just answer for first sentence because we already have the answer. Yeah, because I won't like era to be at the beginning. How would you describe your tenure as a health minister since your appointment in 2018 December?
Yeah, it was both challenging and both exciting. And I think that it also brought out in me some of the potential which I may not have been aware of. That is, for example, the courage which drove me through all those crisis health emergencies. So that's why I say it was both challenging and exciting. But maybe on a later note, I feel always humbled, when I travel, when I go to the shops. People will come to me to greet me. Some will ask for photo to be. So it's very humbling. Yeah, and I really have enjoyed that part of humanity.
Did you ever think one day that you in the position of a minister?
Not at all. And it has never been my ambition, because I have always considered myself as a technocrat, a professional, and that I have accomplished with a great satisfaction. And I have never ever had any ambition to go beyond that. But as it came, it's just like many of the challenges I have been given, whether it's from the party side or from the government side. I was trained, to be humble from my parents, to be humble. And I also trained not to not to refuse if you ask to serve. So that has guided me through.
So would you say you have served to your best abilities?
I can say that I have spent a great deal of my life serving the nation, and I feel that I also need to have time for myself to do things which I really want, like trying to write something, to record something, and then also to be very, very close to my profession.
So apart from writing, what other do you what you do in your free time?
No, it is basically sports.
Kind of sports?
Okay, not me. I used to be a very good soccer player.
Mm.
I used to be a very good soccer player. That's why soccer is also my passion. But I follow also like tennis, boxing, rugby. Those give me some relaxation. After a heavy day, then you go there, you watch soccer, watch tennis, you,
It
you
have to be
relax.
international or local, just as long as it's soccer.
And soccer, whether it's
General.
local or international. Yeah.
So how many years did you spend in the army and how many as a doctor? How old were you when you became a doctor?
You see, when I left the country in 1974, some of you were not born. Uh, I went straight to the military training in the Soviet Union. It was a very tough military training. So I trained as a soldier. Then I operated at the Eastern Front. That is the front of the current Zambezi. Then I went back to continue my study, completed as a medical doctor. I came back to Angola. Then when I came back to Angola, I came to the area of Rumbango, where we had a 300-bed military hospital under the caves with every setup, theaters, intensive care unit, pediatrics, 300-bed hospital. But when you walk, you will not see that there is a hospital.
In Lubango?
Yeah, in the area of Lubango, not in Lubango itself, but in the bushes and the mountains so that no enemy will be able to spot it. Yeah, so that is where I spend my time there as a head of that hospital. We're working 24 hours, 7 days a week. Whenever there is a need, we are staying there. Patients come anytime from the front, wounded, anytime we treat them. So that has been the life outside. There was nothing to think about salary or leave or whatever. Nothing. You don't know about this thing. It's a war. It's a war situation. Yeah, of course, we just came to relax when the country was independent. And then now we are talking about salary. Those things never exist in everybody who was there. They're fighting to free the country.